Welcome back. You all are watching the NDTV Detol Banega Swasth India campaign special show Swasthya Mantra. Detol Banega Swachh India was a 5-year-long campaign launched to complement the Swachh Bharat mission by addressing the rising need of hygiene and sanitation in India. Reckitt Benckiser has invested to drive behavior change through school hand wash programs and to improve sanitation facilities through programs like Hygiene Index. Joining me on this panel is Ravi Bhatnagar, Director External Affairs and Partnerships, RB. Pinaki Ranjan Mishra, he's from EY, he's a consumer leader, Ernst & Young. And we have Ramona El Hamzoui, she's the Acting Mission Director, USAID India. Thank you all for joining us. Ravi, first of all, I would come here, I would like to ask you, tell us about the Hygiene Index. In fact, even the Hygiene Bond, it's just been over a year when you all have launched it. Just tell us about it, please.
Thank you so much. It's a great privilege to come back on the show, and this is a very, very special day. And on the same day last year, we made our commitment to launch the Detol Hygiene Impact Bond. And I'm very proud to say, we have averted more than 7,000 deaths arising out of diarrhea in the period of 1 year. And there were more than around 11,000 plus kids who were seriously critical. So we made them reach to the private and the public healthcare facilities. So to us, the bond is working perfectly fine. And there is a lot of demand coming from the public health practitioners in the state of Uttar Pradesh to take it to all the districts in Uttar Pradesh, as well as when we shared it with others in Bihar and other places which are, epicenter of diarrhea. Yeah. So a lot of excitement is there on that. The big difference is the financing mechanism. So it's not like you're writing a check to someone and saying we are paying you this money for doing this charity work. First you bring the results and then we pay you. So it's a result-based framework which we have started. Although a lot of people say in India something like this doesn't work, philanthropy is different, but we are seeing the quick successes of this work. And on the top of that, the first question what you mentioned was on the Hygiene Index. Yeah. So we started the Hygiene Index work when the Chris Martin and many others were there in Mumbai during the Global Citizen launch. And we took it to 25 cities in India. And we partnered with the Government of India in various states, and now it is Swachh Sarvekshan, where we see Indore is topping again and again, and Varanasi has also come in the top 10 cities under the Swachh Sarvekshan. It's a very good feeling cities are experiencing progress, but there's a long way to go for everyone. And at the end of this, what we are also observing is with this corona coming, lives have changed. Some people are saying this is the new normal, but I don't know it's new normal or what. I must say the efforts must multiply. What were getting put by various people like the doctors, nurses, paramedics, as well as the sanitation workers. Because if I tell you most at risk is sanitation workers also. Because as the population is increasing who is COVID affected and infected. So we are seeing they have a lot of masks are getting used, the PPEs are getting used. The sewage distribution system is very different in India, so we need to do something for them. So that's one thing. So hygiene, teaching them the basic hygiene so that they take care of themselves at this moment is super critical. Otherwise, day is not far when many of them will also get infected because of someone. So why one should be responsible for that? So we need to think about it.
Okay. Pinaki Ranjan Mishra, EY India Consumer Leader, Ernst & Young is also with us. Pinaki, we believe EY has been playing a role in hygiene in India. Can you let us know how?
I think, as Ravi mentioned, we have been partnering with NDTV and RB on this program for the last couple of years. We have been instrumental in actually creating the hygiene impact, the whole measurement systems, and then tracking the 25 cities that Ravi mentioned.
Yeah, okay.
And it has been a very interesting journey. I think this whole hygiene index helped bring to the fore of what we should be doing. It also helped a kind of a competition, as I've told in the earlier meetings, is that it helped cities to compete with each other to look at best practices practices, to learn from each other, and there has been a substantial improvement over the years. So, and I think our role primarily has been to craft the program, monitor the program, and also give the kind of measurement and statistics and advice to these cities so that they could improve over a period of time. And we have had very active participation from the other stakeholders who were along with us in the whole journey, apart from, of course, RB.
Yeah, I'd like to ask Ms. Ramona a question. Ma'am, what is USAID's strategy on health and water sanitation and hygiene, which is in abbreviation WASH? And how is USAID partnering with Reckitt Banks on nutrition, hygiene and sexual well-being, working with RB?
Thank you very much. A few points to add to that question, and thank you for asking that, and really happy to be here today on the panel. So USAID and the government of India, we share a development partnership which spans more than 70 years. And today this partnership really looks at ensuring that the gains that we are reaching together in development are felt amongst the people across all communities. So the focus on inclusive development. And we've adjusted our partnership to better recognize India's leadership as a major donor in its own right. So when you look at our strategy and our approach, we work really closely with the government's initiatives, very bold initiatives to improve the lives and health of people, such as has already been mentioned, the Swachh Bharat initiative, the Ayushman Bharat initiative, the health insurance plan to provide healthcare for nearly 500 million people. And so we look, again, our strategy is we look at the government commitment and the growing and active engagement of the private sector. And we work with a unique partner-to-partner model to address this. So we work with the government and a range of private sector actors. And our focus together, which is really important, is to identify, pilot, and scale up these cost-effective solutions and best practices for India's development in this sector and across all sectors. And we think this integrated approach with private sector engagement and sustainable financing, which is something I'll talk about in just a minute also, as Ravi had mentioned. It includes really strong practices in procurement. And in the WASH sector, we look to enhance the impact of our own investment and commitment with all of the partners so that we can increase access to services in India's urban WASH sector. So when you look at the partnership that we have with RB, we're really pleased about this. And we're results driven, as I think you all are as well. So we developed the first health development impact bond in Rajasthan to improve maternal and child health death rates. So unlike traditional development funding, with a development impact bond, payments are made only if measurable and verifiable outcomes are achieved. And it's innovative, sustainable, it's a market-based financing mechanism, and it takes a business approach. So together with RB and state governments of Madhya Pradesh and Uttar Pradesh, we're using this development impact bond model to improve nutrition status of 30,000 TB patients and avert 700,000 diarrheal deaths. So two areas where our work aligns really well with both RB and the state government's interests. So I'll end there, but we've got a long partnership with RB.
Wishing you all the best, Ramona, for that partnership. Thank you, Ramona, Pinaki, and Ravi for joining us.